is Carlos Santamaria, Associate Editor with DevEx. We're here with Gaston Picchio, Global Hepatitis Area Leader for for Janssen. Janssen is a unit of global pharmaceutical giant Johnson & Johnson, tasked with developing and discovering innovative medicines around the world to better serve patients. We would like to ask Gaston more about this recent report by the Economist Intelligence Unit that predicts a very dramatic uptick in cases of hepatitis C by the year 2025. Gaston, what have we done wrong to get to this situation? What are the main challenges ahead, and what can the aid community better do to address this problem?
Yeah, the Economist report really makes three very specific recommendations. One, that there's a need for more effective disease surveillance. The second one, that there is a need for more screening and diagnosis. And thirdly, there is a need for better outreach. I think, as you pointed out, hepatitis C will generate a huge public health problem by the year 2025. As a result of millions of people having been infected for many, many years with the disease. If left untreated, hepatitis C can result in cirrhosis, sometimes in decompensated liver disease, liver cancer, and eventually death. So just to give you an idea, about for every 100 patients who are infected, about 20 of them will eventually develop cirrhosis, and about 5% of them will eventually develop liver disease and potentially die of liver cancer and potentially die. All of this in the course of about 20 to 30 years of infection. So it's really imperative that we all work together to address the issues related to hepatitis C. I think there is going to be an opportunity for the private as well as the public sector to work together. Several countries around the world are now taking a comprehensive approach to tackle the silent epidemic, as it's called in the report, with national policies on HCV through recent government pledges to fight the disease. While all of this is a very positive step, and hepatitis C is being recognized finally as a public health issue at the government level, I think the Economist report shows that there is still much to be done to address the disease effectively. At Janssen, we are helping first and foremost by bringing new medications to treat patients. We have brought the first protease inhibitor, the and we continue to secure approval and access of this drug in many, many countries around the world. And we're equally committed to bringing our second generation protease inhibitor as well to patients around the world. So in essence, finally, I think after many, many years, hepatitis C is starting to be recognized as a public health issue. And finally, I think we're starting to see governments and other entities, private as well as public advocacy groups, starting to work together to really bring the necessary attention to be able to eradicate this disease after many, many years after its identification back in 1999.
Mm-hmm. Janssen is as a part of Johnson & Johnson is a private sector company. What would you think is the business case for other companies from the private sector to join in as partners in this global struggle against hepatitis C?
As I said before, I think there is a need for everyone to work together. There's obviously significant room for other private entities to work together along with the government and other agencies to bring us a solution to hepatitis C. I think the size of the problem is so big that this is not going to be solved exclusively by one private entity or by two private entities. This will require a coordinated effort from private entities, so potentially different pharmaceutical companies, as well as different governments across the world and different health organizations, including but not limited to WHO, CDC, and other advocacy groups or awareness organizations like the World Hepatitis Foundation and many more.
If you were a major donor that really wants to become engaged in this initiative to help eradicate this disease, where would you spend your money? I'm thinking priority areas. Would it be more technical assistance? Would it be direct budget support for governments to fight the disease in their own countries? How would you spend your money if you were a major donor?
So I think there are many areas where the money could be spent. Obviously, an immediate one that anyone would recognize would be, access to treatment. But before we consider access to treatment, I think we need to determine the size of the problem. So I think there's a need to improve, the disease surveillance. So I would definitely invest money in improving surveillance at the national level. Just to give you an idea, for example, today only half of the countries monitor the chronic form of the disease, which can lead to cirrhosis and liver cancer. So obviously there is a need for more countries to monitor the chronic form of the disease more effectively. There is a need for screening and diagnosis. If we don't screen and diagnose, we will not really understand the true magnitude of the problem, not at the different national levels. And finally, we need to create better outreach. I think we need to continue to create awareness on hepatitis C, and especially stigmatize the disease, because the stigmatization of the disease has been one of the factors that has slowed down the progress in eradicating this disease as well.
Okay, those are very interesting insights. Thank you for having us, Gaston.
Thank you.
Thank you. Stay tuned for DevEx for more breaking news coverage of international development activities.